Welcome to today's Explainer. We're jumping right into a really deeply moving analysis of a massive systemic issue, the challenges facing India's healthcare system. The source material we're looking at today is this powerful, impassioned speech that completely strips away all the complex policy jargon and just looks directly at the raw human experience. So let's get right to it.
Okay, let's dive into this. It starts with an incredibly heavy question. What is the value of a human life if healthcare is simply out of reach? This analysis doesn't kick off with, boring charts or hospital budgets. Instead, it sets this urgent, almost philosophical tone right from the very first word. It really forces us to take a step back and reevaluate how we measure a successful society. It pushes us to consider that all our technological and economic progress means absolutely nothing if the basic ability to preserve human life isn't accessible to everyone.
Now, bringing this down from the philosophical to the day-to-day reality of millions of people. Think about this. Every single morning, hospitals across the country open their gates to thousands of people who walk in with this profound sense of hope. They believe they're finally going to find a cure, a treatment, or honestly, just some basic relief from their pain. But the heartbreaking reality? Not everyone finds that relief. Despite all that hope, so many people are met with just insurmountable barriers that completely block them from getting the care they so desperately need. And this brilliantly illustrates a massive, kind of crushing paradox. On one hand, you have brilliant doctors, incredibly advanced facilities, and world-class life-saving technology. But then, simultaneously, right outside some of those exact same hospitals, you have families literally sleeping on footpaths because they can't afford a room for the night. You have parents who are skipping their own meals just so they can scrape together enough money to buy medicines for their sick kids. It's a stark, jarring contrast between cutting-edge medical advancement and a severe, severe lack of basic access. Let's really ground this in the human cost, because we're talking about extreme sacrifices here. Imagine having to travel hundreds of kilometers from your village simply because a single specialist isn't available anywhere in your district, which is wild when you consider that while nearly 70% of the population lives in rural areas, the vast majority of medical specialists are concentrated in urban centers. So you have families selling off their land, parting with family jewelry, or taking on crippling debt for just one treatment. You've got patients waiting in lines for hours, sometimes days, just to hear their name called. And you have elderly, vulnerable people forced to take long journeys on overcrowded trains because care just isn't available locally. The physical and emotional toll is just immense. It is so easy to view systemic issues as distant statistics. It's easy to detach. But the source makes a really poignant point here. These are not scenes from a movie. These aren't dramatized narratives. These struggles are the genuine lived experiences of actual citizens, happening every single day. This is the stark reality of the healthcare gap. Now, I want to be super clear about something, and the speech is very explicit about this too. The medical professionals, the doctors and nurses, they are absolutely not to blame here. In fact, they are working incredibly long hours under just unrelenting pressure. As the analysis points out, the problem is definitely not that our doctors don't care. They are doing absolutely everything humanly possible within the high-stress, overworked environments they operate in. So if the staff is doing their best, the focus has to pivot directly to the systemic infrastructure. It asks a really vital question. Does our healthcare system give them enough support to serve every patient with dignity? Because if your healthcare workers are completely burning out, it means the system itself is failing. It's failing to provide the staffing, the facilities, and the basic resources needed to actually treat patients the way they deserve to be treated. And that brings up a really tough, fundamental question of fairness. Why should a person's chance of survival depend on where they were born? Just pause and think about the weight of that geographic inequality for a second. If you live in a major city, you might have access to the best life-saving technology in the world. But if you're born in a rural village, your chances of surviving the exact same illness plummet dramatically just because of geography. Then there's the financial side, which forces just impossible choices on people. Why should a poor family have to choose between saving a loved one and falling into absolute debt? Healthcare costs right now are acting as a massive driver of poverty. A medical emergency shouldn't be a financial death sentence for an entire family, but unfortunately, this is the agonizing choice forced upon vulnerable people every single day. So what does this all mean for how we define progress? It really argues for a fundamental redefinition. True national development isn't measured by infrastructural vanity, right? It's not about building the tallest, shiniest buildings or hitting some massive economic milestone while everyday people are suffering. No, True development is achieved only when the absolute poorest citizen can actually receive timely and affordable medical care. Let's move to and see how this builds into an actual roadmap, because this isn't just a critique. It offers 5 practical steps for reform. Step 1, build stronger rural hospitals to bridge that geographic gap. Step 2, increase the raw number of doctors and nurses. Step 3, provide affordable medicines so nobody has to skip meals to survive. Step 4, improve emergency services for timely care. And finally, Step 5, fundamentally increase overall public healthcare investment. It's a clear, structured path forward. Ultimately, the source leaves us with a pretty profound warning. The measure of a country's greatness is really in how it treats its sick, its poor, and its most vulnerable people. We cannot wait for another massive crisis to remember what our true priorities should be. Ensuring that absolutely no one is left behind has to be the foundational goal from the start, not just some afterthought. So the crucial point is this. It all boils down to one core thesis. Healthcare is not a luxury. It is a basic human right. This simple, powerful statement completely rejects the idea that medical treatment is just a commodity for those who can afford it. It places a strict, undeniable moral obligation on the system to provide for everyone, unconditionally. Which brings us to a final, incredibly poignant thought to wrap up today. A hospital should be a place where hope begins, not where it ends. It's a real challenge to look at the institutions we build and honestly ask ourselves if they are actually serving the people who need them the most. So I'll leave you with this to reflect on. How must our systems be reshaped so that hope is the reality for every single patient who walks through those doors? Thank you so much for joining me for this explainer, and keep asking the big questions.